Hi, today we'll talk a little bit about kidney stones. Kidney stones have become more common among Americans. In fact, 1 in 11 Americans will develop kidney stones in their lifetime, which usually comes down to 11% of men or 7% of women during their lifetime will develop kidney stones. What are the symptoms of kidney stones? Symptoms of kidney stone can include blood in the urine, frequent urination, pain in the kidney area, which sometimes can radiate down to the groin area. How do we diagnose kidney stones? Ultrasound and CT scans or X-ray can show kidney stones. What are the risk factors of kidney stones? Risk factors of kidney stone most commonly is dehydration. Many Americans are very busy, they do not drink enough water. We recommend 8 glasses of water or 2 liters of water a day to prevent kidney stones. Other risk factors include family history, also include high salt intake, also high protein diet. Many patients on Atkins diet will develop kidney stones because their urine becomes quite acidic due to high protein intake. Treatment for kidney stones. Treatment of kidney stone depends on the size of the kidney stone and the location of the stone. If the stone is less than 1 centimeter located in the upper or middle part of the kidney, recommendation include extracorporeal lithotripsy, which usually lasts about 30-40 minutes. It's a same-day procedure where an ultrasound and electric energy combine to fragment the stone into pieces. The success rate for less than 1 centimeter stone in the upper or middle part of the kidney is about 90%. However, if you develop obstruction, means the stone is stuck in the ureter. If the stone is stuck in the ureter and the stone is less than 5 millimeter, your urologist should likely recommend your medication to help you pass the stone, unless you have fever or kidney dysfunction. If you develop kidney failure or fevers, you will most likely require a placement of a urostent. If your stone is more than 2 centimeters, the recommendation would include percutaneous nephrolithotomy. That includes making a small hole in the back directly into the kidney and using a camera and an ultrasound mechanical force to break the stone into multiple pieces, and many times those fragments can be automatically sectioned out. And this treatment option is very effective in stones more than 2 centimeters with a clearance rate of above 85 to 90%. If your stone is stuck in the ureter and you failed the medical therapy, or if your stone in the kidney, in the lower part of the kidney, that's less than 2 centimeters, your urologist may recommend uroscopy. That includes a small flexible camera, it's about 3 millimeters in diameter, inserted through the urethra into the ureter into the kidney. We use a laser to fragment the stone and use a tiny little basket to grab the fragments out. After uroscopy, a stent is frequently placed. A stent is a temporary plastic tube that can be removed usually in about 5 to 7 days after the procedure. If you have a kidney stone, the chance of you recurring for another kidney stone in 5 years is more than 50%. And in 10 years, your recurrence rate is about 80%. So if you have a kidney stone, it is highly advisable to follow up the urologist to determine the reason for developing kidney stones. We usually have testing such as 24-hour urine, metabolic workup, blood testing. Sometimes that can include thyroid and parathyroid tests to determine what causes those kidney stones, therefore to help you prevent those painful episodes. Thank you.